Hey besties, welcome back. This is Yella Med, and this is the last part of my patient safety series, and it is part 4. In our last episode, we focused on how errors happen. Today, we're turning to one of the biggest areas of hospital safety: infection prevention and control. Hospitals' acquired infections are among the most preventable causes of patient harm. The good news is most of these can be avoided with strict adherence and evidence-based precautions. So let's break it down. First are isolation precautions. I first want to talk about droplet precautions. This is when you want to put on a gown, gloves, and a surgical mask. These are required for when people have, say, influenza, Legionella, Neisseria meningitis, pertussis, and mycoplasma pneumonia. You will get questions saying a patient has pertussis, what do you have to put on before you go see the patient? And they'll give you A through F saying gown and gloves, gown, gloves, and a mask. So just try to pay specific attention on which precautions are used for each. So moving on is airborne precautions. So in addition to gown, gloves, you also need a respirator or an N95 mask. Patients who need this are patients who have TB, COVID-19, smallpox, or measles. It should also be noted that these patients should also be wearing a mask themselves, and they should be in a negative pressure room. Lastly, moving on is contact precautions. This is when you just need a gown and gloves. You don't necessarily need a mask. Contact precautions are critical for infections like C. diff, Shigella, and EHEC. So I think of these as like diarrheal illnesses in the hospital. Moving on to ventilator safety. So patients on mechanical ventilation are at high risk for ventilator-associated pneumonia. The cause of this is bacterial colonization of the airway, aspiration, or poor oral hygiene. And ventilator-associated pneumonia has increased risk with long-term mechanical ventilation, deep sedation, and frequent circuit changes. So it's important to know how we can reduce this risk, and we'll first start with using only light sedation and avoiding over-sedation. We also want to make sure to place patients in a semi-recumbent position rather than laying flat. This just means that the head of the bed is elevated to around 30 to 45 degrees. We also want to make sure to perform regular oral care with chlorhexidine, and this is just to decrease any oral or GI bacteria because we don't want any colonization. It's also important to stop the patient's PPI if they are on one, because the PPI will decrease the acid and ultimately increase the risk of infection, which is also something we don't want. If someone's on a vent, we also want to make sure to use subglottic suctioning to prevent pooling secretions and limit unnecessary transport and circuit changes to the vent chain settings. This will decrease the risk of microaspiration. Lastly, when it's safe, we always want to wean off as early as possible. Typically, this occurs when the oxygen needs are low. Usually the FiO2 is less than 35% and the PEEP is less than 5. Moving on to central line safety. Specifically, we're going to talk about first central line associated bloodstream infections. Usually in the hospital, they call these Class Bs, CLABSI, and they're highly preventable. The cause of this is just infection introduced through central venous catheters. And some risks of this are TPN infusions, femoral site placement, and prolonged line use. So how do we prevent central line associated bloodstream infections? First, you always want to perform sterile technique. So when you're putting in the central line, you want to put on a mask, a cap, sterile gown, sterile gloves, and a large drape. You also want to use chlorhexidine for the skin prep. We always prefer jugular or subclavian lines, and we try to avoid femoral sites whenever possible because femoral sites will have higher risk of infections. We also want to remove lines as soon as possible when they are no longer needed. And lastly, TPN or total parenteral nutrition should always be given via a central line. But that increases risk, so just make sure you're very vigilant if your patient needs that. Moving on to catheter safety of urinary tract infections linked to catheters, which are another form of preventable harm. These are known as cauti, C-A-U-T-I. The cause of this is just bacteria entering the urinary tract via indwelling catheters if your patient may need that. And a risk of this is prolonged catheter use, breaks in the closed system, or the bag kept above the bladder. So how do we prevent catheter-associated urinary tract infections? First, we want to insert urinary catheters only when absolutely necessary. And we also want to use the sterile technique like I talked about before when placing a catheter. We must maintain a closed drainage system. This prevents bacteria from entering the bladder by keeping the urinary discharge or drain and the collection bag sealed. We also want to keep the collection bag of where the pee or wherever it's going to go below the bladder level and off of the floor. This is just using gravity to ensure that there's a one-way flow and the urine does not go backwards, and it prevents backflow. And lastly, we want to remove the catheter as soon as it's no longer essential. Moving on to surgical site safety. The cause of infections of surgical sites is just contamination during surgery, poor sterile technique, or inadequate prep. Some risks of this include poor glucose control, hypothermia, improper skin prep, and delayed antibiotics. It is important to give prophylactic antibiotics such as cefalozolin typically within 30 to 60 minutes before the incision. You also want to practice sterile techniques in the operating room. Don't shave, but rather clip surgical hair, and maintain a normal temperature and good glucose control to promote healing. The last thing I want to talk about is just general hand hygiene and hand hygiene in the hospital. Usually, pathogen transmission is via hands of healthcare workers, and it can get other people in the hospital sick. So how do we prevent this? Remember strict hand hygiene before and after patient contact. We could either use alcohol-based rubs, but these are not effective for bugs like C. diff or norovirus. So remember, you always have to use soap and water and clean your hands that way in those circumstances. We also want to have an increased number of hand washing stations around the hospital and next to patient rooms. We want to post reminders next to the hand washing stations and provide real-time feedback. We just want to foster a cultural safety place that would encourage accountability, especially when washing your hands. So the bottom line of this podcast, I know is my last part and is very short, but infections are not an inevitable part of hospital care. Through precautions, sterile techniques, careful device management, and hand hygiene, we can protect patients from preventable harm and improve outcomes. So this was the last part of my patient safety series. I'm now going to move on to quality improvement and then ultimately biostats. And I hope this helped just a little bit, besties. Good luck studying. XOXO Yella.